Hey everybody, Zach Shelley here, and we're on another episode of Management Unfiltered, a segment off of Dental Unfiltered podcast. And I'm super excited to be here on the show with this special guest today. That's somebody I super respect, and many of you may know his name, and he's been an absolute machine in dentistry over many years of being able to grow practices. I wanted to introduce Kelly Schwartz with Schwartz Consulting Group. So Kelly, why don't you introduce yourself?
Hi, Zach. Thanks. Really appreciate it. I'm not sure what you want to know. I mean, I'm the CEO of Schwartz Consulting Group. My wife and I started our company back in 1993, so 31 years ago. Over those last 30 years, she and I have personally walked in the doors and trained over 850 practices in 30 states in Canada. So we've been grinding. We've been grinding.
To say the least. To say the least. Over 30 years of experience is huge, and obviously over those years, you don't walk right into dentistry, right, and just start making massive waves of, consistent results, right?
I took my business background and systems I had learned in the corporate world and joined forces with a little company out of Dallas, Texas, prior to Anna and I starting our own company. Learned kind of what they had to do, but that's where we really kind of cut our teeth on learning dentistry. My wife was an assistant and office manager in a variety of positions, and so we combined our knowledge and went out there and started working, with our first team, and grew from referral to referral to referral. And what's really kind of funny with our company is we always thought we were a small mom and pop operation for many, many years. And then several years ago, we went to one of the DI summit meetings, and we had taken 0 clients on DI to 55 clients on DI in like less than 3 months. And so they're like, wow, how are you doing that? And then we looked at the results our clients were getting, and that was the real wow with Dental Intel. And it was only then that we realized, when I'm standing in front of a group of every major dental consultant I've ever heard of or whatever, only to find out we had, in some cases, more clients than them. My wife and I are the two that do all the training. We now have a little bit of back end support team, but it was quite a thrill to find out what effect we had really been having on the dental industry when we were able to see the results we have and then have an outside source verify those results were really impressive. We knew we were doing well, we just didn't know how well. So that's how we started.
Yeah, and I mean that's results are huge, especially when you're growing a practice, right? The owner wants to see results. And typically, like, let's dive into this because this is Management Unfiltered, right? Kelly, is when doctors want to see results, they go to the office manager most of the time and say, "Hey, what do we have going on? What are we doing?" So when you're going into a practice to grow a practice, how important is it to have a office manager that is grounded and knows everything about the practice? Because that's not always the case.
Yeah, I have an office now. Just spoke with one of my partners, and they have an office manager that's never run an office. All she's doing is filing bills, so she's not able to help. So it's really important that whoever, whatever the title is, office manager, office lead, whatever it may be, everybody really needs to know and own their spot, right? And so having a strong office manager that understands the importance of how effective is your recall system, is it being done, is it being worked, is it being followed, right? When a patient says no or not yet to treatment, what is this system? I call it delayed treatment because I find most people don't say no, they say not yet. Does your office manager, your office lead, are they making sure your systems for follow-up are being done? Are the phones being greeted properly? Who and how are your team handling cancellation no-shows? And those 3 or 4 systems, Zach, are really the foundation to retention and the importance of retention. And in the back office, primary role, as I see it, is to motivate patients to take the next step, to come back for hygiene, to come back for treatment, but to stay in that flow. And so it's critical that somebody on the team, usually office manager, really understands each and every role, and there's somebody holding the team accountable. Even sometimes it's even themselves, right? I could be an office manager and be a one-person front desk for a boutique style practice. So somebody who's holding themselves and the team accountable to doing what the systems are for the practice. I'll give you a good example of this. you know how to make a hamburger, Zach?
Yeah, absolutely.
What would you do?
Well, I'd first take my ground beef and season it and add everything in there, get the grill going, and make the burger patty first. Maybe toast my bun, throw some cheese on that burger and bacon, and, start stacking it up and then put the top on.
So how much salt, how much pepper?
I mean, I eyeball it. I'm an eyeball cook, man.
Okay. How big are your patties?
About the size of the palm of my hand. I look at the bun size, right? Like you want it to kind of match how big your bun is.
So you make a great burger for home and you put bacon on it, as you said, and cheese. But if I'm a McDonald's, a Burger King, or whatever, I have to have a system with no variation. It's it's a 6 ounce patty. It's a pinch of salt or a pinch of pepper. I don't know the measurement for that. One slice of cheese or two, bacon, no bacon, that type of thing. You need to have systems that everybody can follow to get the best result. Because making a burger is one thing. Making a perfect burger that fits the standards of the corporation is really important. So in a dental office, if we have a recall system, one person can't be doing one thing and another doing another, or saying one thing and saying another, or however the systems may be, someone has to be accountable for the standards.
That's so good. We were actually just talking in the practice the other day. The owner was talking. He's like, "Hey, when you get a Chick-fil-A sandwich, how many pickles are on it?" Everybody's like, "There's two. There's always two pickles on the sandwich." And like you said, it's the standard, and that's something that I think a lot of dental offices miss the mark on. Or, and it's not that they don't have a standard; it's that they haven't clearly defined that standard and how to keep that standard accountable to the patients. Because you could tell me more than anybody, Kelly, when the standards aren't followed and they're not enforced, patient experience declines.
Yep. And to that, I mean, there's variations. Like, Zach, you might order with no salt, right? Like, go to McDonald's and order French fries with no salt. It's going to take you forever. They'll do it. They have variations, but it's a pain, right? But the majority of the people want salt, and even McDonald's, that varies. Salt's on the fry, but it's not supposed to.
Correct. Yes, yes. I love that. That was great nugget. Docs, if you're listening to that, like first nugget of this episode, really like look at how your hamburger's made. And it might sound funny and saying that, but like your hamburger is your patient experience. Your hamburger are your systems that go through your office. So you have a full menu of systems that these patients see and they experience and they come through your practice. And you need to make sure that every single one of those systems are done the same way, because the biggest problem we have in practices with patients is because we have inconsistencies in what we're doing. So a patient has it done one way the first time and a different way the next time, and then a different way the third time, and they're frustrated because they're like, I don't know what's normal. And so we need to get that systemized. Kelly, that's amazing. I mean, I just learned a ton from you right there.
Another area in these systems, whatever they may be, recall, cancellation, and so forth.
Yeah.
Zach, do you know the number one reason patients leave a practice?
It's because we don't reach out to them, answer the phone.
Yeah, it's that combination, and what Stanford University says is it's a lack of indifference or caring by we'll call it the doctor or staff, right? So let's say you're overdue for hygiene. How frequently, how often do I call? When do I leave a message? When do I automate? When do I follow up? How often, if they say no, is it a not yet or is it a never? Treatment. You come into my office for treatment, not a doctor, but you come into our office for treatment and you say, not yet. I got to check with my spouse. I got to look at this or this. And if the team doesn't follow up, breakdown in systems, what does the patient think? Well, it's not important. I don't care. Therefore, they don't follow up. So when I did a interview with Matt and Andrew and I were talking about the unscheduled treatment follow up, gave him a few tips on things to do. He implemented, he said in the very first week of implementing, he had $20,000 scheduled that he hadn't had scheduled before. Following that system of follow up. And now it's the standard operating in his many practices. He's going to see hundreds and hundreds of thousands in results over the next year.
Yeah, that's amazing. And to think about it, I talk to my team all the time. Like when a patient declines treatment or delay their treatment, for lack of better words, one of the biggest things is we have not made it apparent to these patients that it's important. Like you have just said, like there's no value given to them why we need to get this done. And then when we mix that with zero follow through and follow up with the patients, there is no care in the world because like, well, my doctor hasn't come back and told me to do it. So something that we've been doing in the practice is before the doctor leaves the room, I want you to get back in here and schedule this appointment for that crown that you need that we just talked about. I want to see you back. And the doctor's telling them, hey, I want to see you back in here because it's important to me that you get this done. And then having the rest of your team reinforce. Dr. Calderon just said, hey, I want to see you back. We need to get you back because he wants to see you. We need to get this fixed for you and putting that urgency towards it.
So you ready to have your mind blown?
Let's go, Kelly. I'm ready.
As an adult, do you like to be told or asked?
Oh, asked.
Okay. What did your practice just do?
Told you to do something.
Yeah. And I don't really I don't really care what you want, right? Instead, I need to ask, Zach, do you want to save this tooth? Is this a priority to you? Do you want to save time, money, and discomfort? Because if you want those things, Doc wants you back here in the next 2 weeks so we can avoid all these things for you. So, in our coaching, we teach how to improve case acceptance, recall, delayed treatment, cancellation no-shows, defining roles. We have a whole buffet of practice management systems we teach. But one of the biggest mistakes that teams make in the back is they tell patients what they need instead of asking what they want. So they might say, well, Zach, you've got this large cracked tooth, you've got a broken cusp. So you're going to want to get let's get you back for a crown in 2 weeks. Instead of saying, Zach, do you see this cracked tooth? Does that concern you? Are you aware of what could happen if you do nothing? Well, Zach, if you want to prevent that from happening, you're going to want to get back in a couple weeks. And if now's not the great time, which, if you don't have time for an emergency, don't put this off. But if we don't hear from you, I'm going to have my front desk follow up with you in the next 3 weeks because I don't want this for you. Zach, are you okay with that?
Yeah, absolutely. I love that, Kelly.
So when you tell someone what to do, they've got to have all the same values in you, and you're doing what's best for you as a practice instead of asking them do they want whatever it may be. Another way to look at it,
Dang, that was like mic drop moment there, Kelly. Like you're like, man, you hook, line, and sinker this situation right there. You're like, yep, a little bit more. Oh, gotcha.
Yeah.
No, but that's amazing because psychologically we don't think about that, and then you ask that just very basic question: do you like to be told or asked? And yeah, I like to be asked. I'm not going to have people walking around telling me what to do. And I mean, maybe that's why I'm a manager. Just totally kidding. But that's a valid point.
Another, the way teams speak to practices, as an office manager, even dealing with your team, right?
Yeah.
If I were to give you 3 options, Zach, I think, Zach, I feel, or Zach, I believe, which one of those 3 carries the most weight?
I believe, because there's fact behind that. There's that evidence.
See, if I tell you what I think, you might not care what I think. We don't have the same values. If I tell you what I feel, I'm not a feeling person. But if I tell you what I believe, this is what I would do if it were my mouth, it carries way more weight. And these little phrases that you use as a team can be all the difference it makes from getting the work done. For example, if I said, Zach, I think if we do a filling, it'll stop that tooth from hurting. You think? You don't know?
Yeah, exactly.
Or,
yeah.
Or, I feel like a root canal might be the best treatment, or I feel like you feel like. I don't value your feelings, right?
Yeah. I'm not paying for your feelings.
Yeah. But my mouth and you were my brother, this is what I would do. This is what I believe is going to give you the best, whatever you're looking for. So little things like that can really be the difference with a good team, good communications, a strong office manager, a strong, front to back communication. It's really, really important to driving success to your team. And then on top of that, measure that. Yeah. So one of the things that we do is we measure, and it's a real indicator of overall effectiveness of all your systems. So Zach, what do you think is the number one measurement of the overall success of your team?
That's a hard question to answer, Kelly.
Yeah, it is, but it's really straightforward. So let me let me reel it back.
Yeah.
What are your doctors trying to accomplish? They're trying to get patients to do work, right? Your schedule, your financial, your recalls, all about getting right. Yeah. So your number one monitor is case acceptance. If you're not presenting properly, if you're not scheduling properly, if you're not following up properly, your case acceptance will be low. So in our measurement, we track, close to 100 practices we have using tracking software. We happen to use Dental Intel.
which is amazing, by the way. So if you all don't have it, DI is the way to go to track your metrics. So all the listens in there, yes, we use it here too.
If you're a listener, and I think I offer this on your Facebook page, but if one of your listeners or several have questions about DI and how effective they are, I'll be happy to jump on a Zoom, review your numbers, give you like a 1 hour talk. But so the standard that we find is that 80% of the patients you present treatment on should be scheduling at least something, or what I'll call phase one, and 50% of the dollars you're presenting should be scheduled. So I call it the 80-50 rule. 80% of your patients scheduling 50% of the dollars. And that's your baseline to your effectiveness. Now I have some offices that are 90-60, 90-70. I have one called me up and Kelly, we were 98% of our patients scheduled last month. Phenomenal. But that's your baseline. And then from there, you start looking at, all right, what are we doing? Is it the way we're communicating in the back? Is it the way we're passing the patient off to the front? Is it the way we're doing financials? Is it the way we're scheduling? We start breaking down the systems that cause the case acceptance to go up. Our average office, single doctor, 1 to 2 hygienists went up 360 grand last year. That's the average. Some were higher. I had one group practice went up 1.7 million, 12 months working with me. So this is your baseline that your team need to know. And so from an office manager standpoint, your team falls into one of three categories. You're either winning, losing, or don't know the score. And losing is the worst case to be in. Or I'm sorry, not knowing the score is the worst. If you're losing, you can make some changes and come back, come from behind, finish the month, week, or year strong. If you're winning, keep reevaluating your systems and how can we improve. So if we're 80-50 already, then how do I get to 85 and 55? How do I get to 90 and 60? How do we keep moving the bar in the right direction?
I already have a whole page of notes, Kelly. So everybody that's listening in here, if you're still listening, don't stop, because it's only getting better as the minutes go by.
So let me throw one more at you. And I know this one, I get excited about this stuff.
Yeah, absolutely. Let's go.
I'm a teacher nerd, right?
Yeah.
But when your doctors, for example, diagnose with your, and some call it co-diagnose with your hygiene in your system. But when your doctors are looking in the mouth and you've got issues going on, and I ask you, Zach, do you want to save that tooth? And you say yes. Okay. What time frame, or do your doctors give a time frame when they want the patient back? What would they normally say?
I mean, the ideal thing is, right, have your booking out for treatment, no longer than 2 weeks. So we're saying, we'd like to see them in the next week to 2 weeks.
Okay, perfect. Because one of the more common mistakes most practices make is say, let's get you back as soon as possible.
Yeah.
Well, depending on your personal life, like you really value dentistry and I tell you need a filling and let's get you back as soon as possible. You get in, you want in tomorrow. We don't have tomorrow, you're pissed off, right?
Yeah, exactly. You got to set expectations.
Yeah. And if you don't value dentistry and I tell you need a crown and I say as soon as possible, you're thinking by the end of the year. And that's not what you earlier. So if you're huddling, for example, and I'm a big fan of having a morning huddle, we talk about how far out are we booking our productive procedures? How far are we booking our basic procedures? So when I diagnose that filling, I can say, Zach, I know I'm scheduling my fillings or procedures like this 2 to 3 weeks out. Don't wait any longer then, because here's what could happen. Or Zach, this tooth is already fractured, needs a crown. I want to see you no later next week. If Zach, you want to prevent it from getting worse. If you don't care if it gets worse, you want to pay me extra, go ahead and wait, And having a conversation with a friend, and again, not you need, because that's my opinion, but if you want, that's going to have a bigger impact.
And I love the way it's approached too, Kelly. Everybody that's listening, like, if you listen to how Kelly is explaining this to us, yes, it's one person's opinion, but he has results and statement of fact behind this that it works, right? So it's not just like do it because Kelly said to do it. Like, do it because we've seen the amass amount of growth in practices when we treat patients this way and giving them, because when it comes down to the brass tacks, right? Do the patients have an option to get treatment done or not? Yes, they absolutely do. We cannot force them to sit down in a chair, anesthetize them, and cut a crown. So they do have a choice. So we need to figure out and this is what I'm kind of just digging a little more granular, is getting down to what's important to the patient. Do they understand how important this filling or crown is? And do they actually want to get it done? Once you find that out, and you ask them, is this, do you want to get this done? Yeah, absolutely, I do. Then okay, done. I know this patient's going to schedule treatment because they just told me they want to get it done. So now it's up to us getting a spot for them on the schedule that works with their schedule and our schedule, and just saying, hey, I've got tomorrow, actually. We can get you right back in. Does that work for you? Is that too soon?
Yeah, and I like to take it a little bit deeper versus do you want to get this done? I appeal to what are the three big reasons patients say no: money, fear, lack of belief, right? So, Zach, do you want to prevent this from getting worse and causing pain? Zach, do you want to save a few dollars? Zach, do you want to prevent an emergency? Well, if you want those things, then let's get you back, or you're going to want to get back no later than, right? Because if I just say, hey, do you want to schedule? You might say, yeah, I want to, but I don't have any money.
Correct. Yeah. So you're covering all your bases.
You're stacking the deck to have the best chance.
Yeah, absolutely. And it gives the opportunity too, if the patient says, hey, I don't think I have enough money. Do you have financing options? Do you have, or if they say I don't have money, hey, great. We do have some options if you're interested. Would you like to hear about what we have for you?
So, Zach, if money is a concern, are you aware that doing nothing can cost you even more?
It's a great statement.
So, Zach, we have payment plans that fit almost anyone's budget. So we have an outside lending source we can work with as long as you qualify through them. We can do a prepayment layaway, or we could save you a few bucks by paying it in advance. But what I'm doing is when I don't let you know there are options, and I share with you, you need a crown. First thing going off in your head, man, that's going to cost me a lot. Man, that's going to cost me a lot. And they stop listening. I gotta zone in on that and pay attention to the patient that's concerned them, and then address that so they can continue to listen to the benefits of treatment.
Yep, absolutely. I was smiling earlier. Some of you are probably just listening on Apple Podcasts, so you can't see my face. But those are actually watching. You can see me smiling while Kelly's talking, and it's because I'm sitting here. I'm like, dang, I want to go get work done on my deed. Like Kelly's already convinced me to go get what I need done, and I don't even have any work to get done. It's truly amazing to see just by verbiage. And let me ask you this question, Kelly, because we're talking about a lot of these, systems and things of how to increase production in the practice, how to get uniformity across the team, systemizing things and standardizing what we do. How important is it, starting from the top down? How important of this role as the office manager rolling this out to get people on board with making this change? Because you probably go into a practice that has never had a consulting group come in, and how do you get people bought in? How do you get the office manager to buy in and want to do this?
Just like you would with your patient, Zach, and I've kind of done this with you. It's about asking questions. So when we come in as a coach, first thing I want to know is not what I'm not going to tell you what I can do and what you should be doing, because then I'm telling you, right? Which is what I want. I want to ask questions. So I'd like to ask the team, what are your 3 or 4 biggest areas that frustrate you, that have you stressed? And they'll say, well, cancellation and no-shows, or patients don't schedule treatment, or we can't keep our hygiene full. Well, do you want some guidance? Do you want some help? Here are 3 or 4 things we could do to prevent these problems. So as the office manager, I would sit down with the individuals or the team and say, what do we feel are our 3 or 4 biggest areas that we're struggling with? And what are the things in there that are happening? So let's take recall as an example, keeping butts in the chair. Having a good dialogue or script. Like, I don't like to be so scripted that I sound phony, right? But if you go to Disney, for example, and you jump on one of the rides, everything pre-ride and during the ride is scripted with pages of variation so that the experience when you go to Disney is true, right? So when we talk to recall, you run a team. Do you know what your front desk are saying when they make the call? For example, I can call up and say, hey, Zach, this is Kelly from Dr. Anna's office. We see you're overdue for your cleaning. Can we get you scheduled? No, I'm busy right now. Click, hang up. Right? So I've lost an opportunity when I reached out to this person versus, hey, Zach, this is Kelly from Dr. Anna's office. Dr. Anna was reviewing your chart. She's concerned that you're overdue for your professional cleaning, oral cancer screening, and exam. And we have a few openings next week that she wanted me to make you a priority, which would be best. So that dialogue is part of that system that is causing the issues, right? Yeah. So I would be talking to your team about what are those issues and then offering solutions either that they have that they've brought from an outside source like us or that the team solved together. Cancellations is always a big one. And this may or may not surprise you, Zach, but do you know what causes the biggest amount of cancellations in your practice?
I'm going to be honest and tell you no.
It's your staff. Because here's what happens. I sit in the hygiene chair. I get my teeth cleaned, and Susie says, so Kelly, let's get you scheduled for your next cleaning. And Susie says, well, let's get you on the books, and if you need to cancel, give us a call. So you just gave the patient permission to cancel. And where technology has really changed, when I ask you, Zach, let's go ahead and get you scheduled, and you say, well, I don't really know my schedule. Instead of doing that, I'm going to say, well, Zach, I'll tell you what, I'm going to send you a link when it gets a little closer to your appointment. Jump on there, pick a time and a hygienist that you want to see. Or Zach, I'm going to set a follow-up in our system to make sure we contact you and which number and time is best to reach you. And I create that follow-up because last thing I want to do is push a person into an appointment and then give them permission to cancel. That is outdated and antiquated because the old system used to be everybody leaves with an appointment. Well, now with technology like LocalMed and Medento and all the software we have, we shouldn't have to do that. And we can get a hold of people way easier than we ever could. I mean, we have cell phones now. When that system was first created, there weren't cell phones. So everybody left. And it was the old red pen and red and blue pens and a book, making appointments and notes. Those days are gone. So don't push patients, to make appointments they can't commit to.
Yeah, I mean that makes total sense. And like you said, you're giving them permission to cancel as if it's okay, and that's one thing we hate the most. So it's like feeding them something you absolutely hate.
When we analyze practices before we start and we see a really, really high pre-appointment percentage, and then we look at their cancellation no-shows, they go hand in hand. The higher the pre-appointment percentage, the higher the cancellation and no-show rate.
That's interesting.
Yeah.
That's very, very
I'd rather have, as an office manager, Zach, would you rather have 3 openings next week you have to fill or 3 appointments you hope are going to show up?
I'd rather know exactly what's going on in my schedule.
Because then you go to your patients, you identify who they are, right? So, go back to your original question about how do we introduce culture? We have to get permission. Guys, do you want to make this better? Do you want to improve this? Do you want resources? Do you want tools? And then we come together and we rally the team around that. And then on the accountability side, I like to ask this simple question. Zach, do I have your commitment that you're going to follow this new dialogue? Do I have your commitment to hold you accountable to this system? Because you're telling me you're committed to doing it. Can I hold you accountable to what you're saying? Think of it like a gym trainer. You can buy a gym membership, but nobody cares if you show up. Matter of fact, they bank on you don't. But you hire a trainer 3 days a week to meet you at the gym, you're going to do things a little more than you normally would on your own.
Yeah, you got to hold them accountable.
You need permission.
Correct. Permission to hold them accountable. Yes. Yeah, I'm going to have to take a quiz after this, Kelly. You're going to send me a list of all these questions. Make sure I got all my takeaways the right way.
Up on a call, Zach. I'm happy to help.
Yeah, no, this is amazing. Kelly, before we wrap up, we discussed a little bit in the middle of this. So all that Kelly is obviously so knowledgeable in all of this. So he is a wealth of knowledge and he can help your practice out significantly. Myself, I run the Dental Office Manager Leadership Network on Facebook, and Kelly is a partner of our group. Kelly is just a great resource. So he had mentioned he's happy to get on a call with you, kind of discover what's going on and see how he can help you. So Kelly, is that the best way for them to reach you?
Yeah, you can jump on my website, kellyschwartz.com. I've got all my, YouTube, social media platforms, so forth you can connect. But on there, you can give my number in this podcast. Give me a call if you've got dental intel. We can just jump on a call. Not going to sell you. I'm just going to talk to you about what are your challenges and maybe why. Give you a few pearls. And if you want or need our help, we're here.
And just a reminder, everybody in this group, this is a podcast that we don't take sponsorships for these episodes. Kelly and I are good, beginning to become good friends, I would say. We got connected here not too long ago with Matt. And so I just want to let you know, this is somebody that I trust, and I really respect his opinion and viewpoint on growing practices and doing it well, and getting real results. So, one, contact Kelly through the group, through his website. Two, if you're not on DI is a great tool to utilize, tracking all your metrics in your practice and know what the score is. Right, Kelly?
Yeah, absolutely. We measure how many calls are being made. We measure all the key things, and then those KPIs, as they're oftenly referred to, key practice indicators. We then have systems and tools to make those numbers go up. If you're just using DI for measurement, you're missing what the value really is, because within there are systems to get those patients back in the chair doing what you want them to do. But more importantly, all these things allow your patients to have better health. Better health, less problems, creates more friends and referrals and an overall experience, and then makes the practice more successful.
Absolutely. Well, Kelly, thank you for taking the time out of your busy day.
My pleasure.
Everybody, thank you for listening in to another episode of Management Unfiltered. Until next time.